Now I'd like to turn it over to Wendy Rickenbach-Barclay of Sarasota, Florida.
All right, so thank you, Becky, super appreciate it. All right, so I hope you guys are hearing some messages loud and clear. For those of you who know CarePatrol, well, first let me introduce myself. My name is Wendy Rickenbach-Barclay. I'm the owner and founder of CarePatrol Gulf Coast, and for those of you who don't know where that's at, that is Sarasota County. And everybody who knows anything about Sarasota, it's lovely, beautiful, we're right on the Gulf, they love it. Not only am I a certified senior advisor, I'm also a certified dementia practitioner, I'm a transitional care manager, and most recently I became a certified Alzheimer's and dementia trainer. So really, really focused in, and I would say if I had any area of specialty, it would be with those who are cognitively impaired. But I wanted to touch base before I move forward and just take a moment to pause, because you just heard from two very skilled, very collaborative individuals, Paula and Julie. And a lot of times people, when they hear CarePatrol or they know anything about, they think we just work with seniors. Well, I don't consider a 59-year-old a senior, maybe because I'm getting closer to that age every day, but 59 seems pretty young to me. So that's what I would say a non-traditional type of person that we partner with hospitals and case managers with that sometimes wouldn't connect the dots, like who in our community can partner with this to make this happen. And then I also want to point out with Julie, I don't know, I did some basic math. From the time Julie got involved until the time these folks were safe was almost 8 months. Now, clearly, those of you who work in hospital rehab settings don't have 8 months to spend coordinating community resources and pulling in those resources to make sure your patients are safe. You typically get about 3 days to turn that train around and figure out something safe for them. And I know your hearts, because I work with our case managers here locally, most of them are nurses, your heart wants to help them, right? And so we're gonna talk a little bit, why would a case manager need a transitional care manager? And that's somewhat of a new term in the industry, but you're gonna find that, you know, I don't like the word placement, because I feel like placement just a tiny bit of what we do. Our goal, just so you know, is to educate every single family, every one of your patients, so they can make informed choices, right? That's most important. And we feel like the placements take care of themselves, and they do. So the goal is to educate and empower people, because they are overwhelmed. You heard Paula talk about communication, communication, communication. Most case managers, you guys have your script, right? There's so many things you have to get through, and we're gonna dig in a little bit deeper. So let me just move forward here. All right, so let's see if this sounds like your day at all, because I'm usually embedded in your day, but you have a full load of patients, right? They all have discharges, everybody's staggered. You're trying to get orders from doctors and therapists and maybe get updates from the nursing team, all while trying to communicate with your family and say, here's the options, here's next steps. And where does everybody wanna go? They wanna go home, right? They wanna go home. But let's just frame this up. They're telling you, the case manager, they want to go home. And you're like, all right, how do we make that happen? And how do we make it happen safely to get that safe discharge? And you're there again, going through your database and your Rolodex of options. And, you know, let's just make up something here. All right, let's just say they have 2 to 3 comorbidities. They're at least age 75, if not older, and they're needing assistance with their activities of daily living. All right. And so you're thinking to yourself logically, or maybe they even have some cognitive impairment, throw that in the mix. And you're thinking to yourself, if I send this person home, you know, even with home health, right? Are they really going to be successful in that environment? So how do we partner with someone to help make that a successful transition and keep them safe? All right, so lots of things happening very quickly. Then what they do is they graciously share with you, well, my kids are flying in. They're going to help out. Now, I don't know about your families. I'm a kid. I've got aging parents who all need care. And when I fly in to help, I'm not staying for a couple months. I'm like there for 3 days, 5 days, a week tops, okay? I love my parents, but I also run 3 companies. And so and I have my own family and my own set of responsibilities, you know what I mean? So loving them, caring for them, and also being responsible in a lot of other areas. So the kids are gonna fly in and they're gonna help out. They're gonna take care of all these things. And so there again, you just went through everything that you needed to do. Now we've got a new player in the scene. right? So now we gotta get the kids up to speed right away. Here's another really famous scenario that you guys probably encounter is that we have two seniors, two elderly seniors. They probably both have something going on, or maybe one is really healthy. Heck, I'll give them the benefit of that doubt. But all of a sudden you've got a patient that needs assistance getting in and out of bed, on and off a toilet, in and out of a couch, in and out of a chair, maybe in and out of a wheelchair. I mean, there's a lot of things that could happen. And is that person physically able to do that? And so, you know, your mind's probably reeling. And all this, we're gonna dig a little deeper into your day because this is just tip of the iceberg. This is the easy part of your day, right? This isn't even where rubber meets the road for what you have going on. Let's just go a little bit deeper. So there's a lot of things that happen in the course, meaning, you know, you guys have your challenges that you're faced with, but then also your hospital or rehab, they have their goals and objectives. Your family has their goals and objectives, and everybody's trying to figure out how to make that work together. Now, I don't know if you guys know this, but about over 80% of seniors over the age 75, and I should have referenced the websites I pulled that from, I'm so sorry, but over 80% of seniors over age 75 with 2 to 3 comorbidities could go home if they had a true caregiver, meaning somebody's willing, competent, and capable. So they may be willing, maybe they are not competent, we don't know that yet, but that capable piece comes into play maybe from a physicality. Can they physically do some of the things I was just mentioning? So here's the gig. Your hospital is a business, right? Your rehab is a business. And so they're trying to run the day-to-day operation of their business, which is serving patients in the community, serving families. But at the same time, they've got to be profitable. They're looking at how they get paid through Medicare, and they're looking at a lot of stuff that really probably means a whole lot of nothing to you every day, which is fine. But when you want to know why your leadership's, I always say, kind of raining down on you, it's not that they dislike you. They have goals and objectives being driven from above them. And at the end of the day, your family just wants to be safe, right? And they just want to go home. And so just a lot of challenges that you guys face on a day-to-day basis. Now, I want you to pause for a minute and think about what if you had a certified transitional care manager, a transitional care manager whose goals and objectives directly aligned with yours, someone who works in tandem with you, doesn't cost you or your hospital rehab any money, and they're going to stay with that patient for 30 days or longer upon discharge, which I think Julie gave that good example, 8 months. I will tell you, tip of the iceberg. I've got families that I've been with for years at this point, and we just keep reaching out, touching base, you know, whatever the case needs to be, trying to move the needle for safety, whatever that needs to be for that family. Now, I love when you guys get somebody, I don't know if you've had this, I'm sure you have, because every single day I get faced with, my mom and dad, they can just go to rehab. They can just go to rehab. They have great insurance, right? They got great Medicare insurance. They get 100 days of rehab. And you're thinking to yourself, you can't send every single human being to rehab, right? There's criteria that people have to meet to go to rehab under Medicare guidelines, you know? And so you're thinking to yourself, not everybody, but they're like, they get 100 days, and they're not realizing that Medicare, I say this all day too, if y'all want to write this down, grab your pen and paper. Medicare is medical insurance, not activity of daily living insurance. I'm going to say it again. Medicare is medical insurance, not activity of daily living insurance. Now, that's not to say if somebody has like an episode of some sort, you know, and they need some nursing services brought in temporarily, like help with showers or this or that, Medicare can help cover that. I also hear this, oh, we're going to send in home health. My mom's getting home health. I'm like, all right, well, that's about 2 to 3 hours a week. Who's going to help her like all day long get in and out of bed and out of the toilet and out of chairs? Who's going to take her grocery shopping, get her to her doctor's appointments? Who's doing all that? Because typically your home health is going to be your PT, OT, speech, and nursing service, right? Somewhere in their mind, in their brains, I don't know, it sounds like when I talk to them, they're getting 12 to 15 hours a day of somebody hanging out with them, helping them out with stuff. Not the case. So I hear it all the time, and you know, a lot of times families also don't understand about how their benefit days work, and not that we want to really be experts, although we all are kind of experts. The reality is they need to understand how it all works together for the greater Good. So what is a true transitional care manager? So I've just pulled up, the transitional care manager is a credentialed expert at transitional care, especially from a hospital setting to wherever a patient's next step is, whether it be home, rehab, or community-based care setting, AKA assisted living. So, that's what they're going to do. So it sort of sounds like what you guys do, but we kind of pick up where you leave off. You guys are experts within the confines of your hospitals and the day-to-day processes and systems and procedures. We kind of are your external person who's managing all the things, like what Paula said, how we have the latest updates on who has availability with the assisted living, the SNFs. We're reviewing care and violation history. We're going to dig a little deeper some of the other things that we're doing, but even from a funding strategy, because I can tell you what I hear every day. Oh, my mom can't afford it. My mom can't afford no care. It's expensive. She's got to go to that rehab, right? Get that 100 days. My mom she can't afford care. My mom has $1,400 a month. I'm like, okay. So interestingly enough, that same $1,400 a month client, not in all cases, but about 70% of the time, 60 to 70% of the time, we can usually educate families with the various funding strategies to keep moms safe, whether that be at home or a community-based care setting, meaning private duty care, right? So they're getting home health at 2 to 3 hours a week. How do we augment that with private duty care, right? Not the neighbor who's going to go pick up the laundry or a prescription or drop off a meal, but someone who's going to help with those activities of daily living. And what does that look like and how do we pay for it? And I will tell you that's usually where most people's objection comes from, is from the money perspective. And it's like, oh, she can't afford it. So we got to help people figure out how to afford long-term care, because quite honestly, they didn't plan for it. If you talk to the seniors of today's generation, those 83 to 86-year-olds and up, they didn't think they were going to be here that long, right? So they didn't plan. I can assure you, our generation should be planning. Anyways, so a true transition care manager should be able to make an immediate and positive impact on your day-to-day. And what I think you're going to find that a transition care manager is going to give you very fluently is the gift of time. The time you wish you had throughout the day to really spend with each and every one of your patients and their families, to really drill down all the different care options, how to put that puzzle together, whether it's short-term or long-term, pending their physical, mental disposition. Obviously, you've got to have a partner that's going to be with you to meet the discharge goals. And also, quite honestly, we want to reduce readmissions. All right. So hopefully, if you guys have any questions, you'll reach out to us. There's going to be a dedicated phone number that you guys can reference, and we're going to repeat that at the end of the call. But I want to thank you for your time, and I thank you, Becky, for sharing me in.
Thank you, Wendy. What a great summary of the services that we provide.